At 6 weeks, I went back to my doctor and I saw the nurse practitioner, and she said that everything is going really good with my recovery. It looks like a little bit of bone growth going through the cage, and as long as I'm careful, that bone should start fusing pretty good, and hopefully in 6 months it'll be fully fused, but we'll have to see. My next appointment will be in March. So at 6 weeks, after 4 weeks, I started my water therapy, and I'm gonna have a few clips of that. What's going on? The water therapy isn't difficult, but it is tiring just because I haven't been using the muscles a lot. Not sure if your PT offers this kind of service, but I think it's advantageous, especially because you're not bearing a lot of the weight, and it's a little bit easier on your back as far as strain wise. The physical therapists are pretty much on it. They're always watching you, and the main thing to remember is pretty much sucking in your stomach and engaging your core. So I've been going to a physical therapy office called Moon Physical Therapy, where they have this HydroWorks machine. You get in and the unit fills itself with water. When you're done, it drains the water and you can get out through that glass door behind me. Pretty much do the same thing for the past 4 sessions, my fourth session right now, where I start off just walking forward, then I walk backwards and I do some side steps and end up with some high knees, and then I go to my upper body exercises. Nothing is too difficult. It is a little bit tiring. The water helps because it takes the strain off your lower back when you're doing any of these exercises. Normally I'm walking on the ground anyway for about an hour a day at this point when I'm not at the physical therapy, so the walking part is no big thing for me. I mean, it's super simple for me, but the upper body exercises are a little bit more difficult, not hard, but tiring, just because I haven't been using my upper body for so long. Haven't been doing a whole lot for so long. At the end of this video, you see me floating. It's just to take some weight off your back, just to suspend yourself in the water. And then after that, I don't have any video of it. You do some leg exercises such as bicycle kicking, some flutter kicks, some side to sides, some hip adductors, hip extensions, etc. I started also weaning myself off my back brace. So at 6 weeks, I'm wearing it 8 hours a day in 2-hour increments and a 1-hour break. And on the 7th week, I'll start going to 4 hours a day, again in 2-hour increments on, 1-hour break after, and back to 2 hours again, and then leaving it off for the rest of the day. As long as it's not bothering me, I can continue doing that. In the 8th week, if everything is going good, the nurse practitioner who I saw at 6 weeks said that I can probably disregard or stop using the brace at that time. Maybe I'll still use it in the car, or if in a crowded area in case you see people, bump into people, just to keep yourself kind of rigid. But that's what's going on to this point, and hopefully if you've gone through it, your recovery is going well also. And if you're thinking about it, hopefully your recovery will be going just as well as mine. Again, same as 4 weeks, don't have any of that back pain. However, I do get a little bit of hip and back pain at the end of my walks. I'm going maybe an hour and 10 minutes or so, maybe about that 55-minute mark. My legs start getting a little tired still, and I can feel that slight dull ache start coming back into my back and hips, but none of that shooting pain going down my hips anymore, and none of that gnawing pain at this time. So I'll give you an update. Hopefully in maybe about a 3-month period on my next doctor's appointment, which will be in March. At that time, I'll have gone through probably about 3 or 4 weeks of land physical therapy. So good luck with your surgery, or good luck with your recovery. I'll talk to you guys soon.